Hello everyone, my name's Tamara Keith and I'm a paediatrics trainee in London. You may have listened to a couple of my other neonatology podcasts. This is a sort of anatomical talk about the physiological adaptations at birth. This is a topic that I found very complicated as a medical student, but it's actually quite important to understand because if you understand this topic, it makes it easier to understand cardiological problems in the fetus and in the newborn baby. So let's go on to talk about the physiological adaptations at birth. So we're going to talk about what is normal in the fetus and what happens at birth. So we're going to talk about what happens in fetal life. So the lungs are filled with amniotic fluid, and this means that there's not really gas exchange in the lungs. That all happens at the placental level. There's high pulmonary vascular resistance, so this means the blood vessels supplying the lungs are constricted, so there is a low amount of blood supply to the lungs. There's low resistance in the placenta, meaning that there's high flow of blood through the placenta. This is the most important area of blood supply in the fetus. The placenta supplies the oxygen to the fetus. There's a patent ductus arteriosus, so only a small amount of blood flows into the lungs. Importantly, and this confused me a lot, but you simply just have to learn it, that the umbilical vein gives oxygenated blood and the umbilical artery carries deoxygenated blood. Blood flow in the fetus. So due to the high pulmonary vascular resistance, blood from the right side bypasses the lungs. So what this means is the blood supply in the lungs is very low and not much of the blood from the right side goes to the lungs. But how does it bypass the lungs? So we have something called the ductus arteriosus, which connects the right ventricular outflow tract to the descending aorta, thus allowing blood to bypass the lungs. The foramen ovale connects the left atria to the right atria. And the ductus venosus shunts umbilical vein blood to the IVC, bypassing the liver. And none of these should be present after birth, but in some abnormalities they are. So you can have a patent ductus arteriosus and a patent foramen ovale, but ordinarily these should both close within 24 hours of birth. So this diagram is just showing these features. So I'm just going to show you what I mean here. So this is the foramen ovale here, where my arrow is, connecting the left and right atria. And up here you've got the ductus arteriosus. So you're connecting the right ventricular outflow tract to the aorta, so thus stopping blood going to the lungs. Because you don't want blood going to the lungs because it's a waste, because there's no gas exchange going on in the lungs. That's all happening down at the placenta, down here. And here is the ductus venosus, so just bypassing the liver. So this is just all happening to increase the amount of oxygenated blood reaching the fetus. So at birth, lung liquid production is reduced during labour, and the infant's chest is squeezed and the lung liquid is drained as the infant is being squeezed, and because lung liquid production has been reduced. During labour, you have increased catecholamine levels, and after birth, this is what stimulates the baby to breathe. The first gasp is normally within 6 seconds of age, and there should be regular breathing within the first couple of minutes. breathing further stimulates absorption of the remaining lung fluid. So you've got a number of factors there going on to reduce the fluid in the lungs, because within the first few minutes of birth, you've got lungs which are full of amniotic fluid, and you need them to become full of air to allow for breathing. So lungs are physically squeezed through the birth canal, and then breathing further stimulates absorption of the fluid. And you may say, well, what happens at caesarean section where the lungs are not physically squeezed? Well, they're not physically squeezed, but the breathing still stimulates the absorption of the fluid. But you do find that babies who are born with caesarean section are at increased risk of having fluid in the lungs, and this causes an illness called TTN, transient tachypnea of the newborn. So other things that happen at birth, very importantly, the umbilical cord is clamped. Venous return to the right atrium from the placenta is reduced. There is a rise in left atrial pressure from increased pulmonary venous return, and the low right atrial pressure closes the foramen ovale. The ductus venosus closes due to reduced umbilical venous return. So the three different vascular parts of the fetus all close at birth. So you've got the foramen ovale closing due to the difference in pressure between the right and left atrium, and the ductus venosus closes because of reduced umbilical venous return. The lung expansion causes a rise in oxygen levels, and lung aeration results in decreased pulmonary vascular resistance. So the pulmonary blood flow increases. And then the flow of oxygenated blood, as I said before, closes the ductus arteriosus. So the connection between the right ventricular outflow tract and the descending aorta closes. If this does not close, it results in a patent ductus arteriosus. A number of factors increase pulmonary vascular resistance and interfere with this adaptation that we've talked about. So if a baby is unwell and acidotic, so they have a metabolic acidosis because they have some sort of infection, if they have hypoxia at birth, if there's underinflation of the lungs, or perhaps their lungs are underdeveloped with pulmonary hyperplasia, or there's a heart problem, this can all interfere with this adaptation, and they result in increased pulmonary vascular resistance, so reduced blood flow to the lungs, and this interferes with all these adaptations that we've discussed. So in summary, in this short podcast, we've talked about that the fetal circulation is different from a baby. The fetal lungs are full of fluid, and at birth these obviously need to be full of air. There is low blood flow to the fetal lungs, and the ductus arteriosus connects the right ventricular outflow tract to the descending aorta, thereby bypassing the lungs. The foramen ovale connects the left and right atria, and the ductus venosus allows the umbilical oxygenated blood to bypass the liver. And as we've discussed, the fetal circulation undergoes significant adaptation at birth. That's the end of this podcast, and I hope that you found that useful. Bye.